Aging gradually shifts how the prostate functions, making it more sensitive to everyday stressors that build up over time. As these changes progress, the risk of discomfort and urinary symptoms tends to increase in many older men. That's why a prostate doctor warns about a common daily habit that quietly worsens these problems over the years. Those are simple science guided steps seniors can follow to reduce that risk and support healthier aging. The habit is prolonged sitting and physical inactivity, very common in older adults. Evidence links it to urinary symptoms, prostate enlargement correlates, and metabolic changes that worsen prostate. Sitting reduces pelvic blood flow, promotes venous stasis, and may increase local inflammation mechanisms, plausibly linking sedentariness to prostate symptom progression in older men. Observational studies associate long daily sitting with worse lower urinary tract symptoms and reduced erectile function measurements in older cohorts, though causality is complex and influenced by biologically, reduced shear stress and slower circulation alter endothelial signaling, favoring inflammation and microvascular dysfunction in pelvic tissues, a plausible path from sedentariness to PAR. Practical application: break sitting with a short walk or standing stretch every 30 minutes. Randomized workplace trials show improved circulation and metabolic markers with frequent breaks. Use simple tools, set a timer, use a step counter, or stand during phone calls. Small habit nudges consistently increase daily movement among older adults in intervention studies. While sitting is the primary habit we highlight, several related behaviors, poor diet, tobacco, and unmonitored supplements also contribute to prostate and sexual health decline in seniors. Unregulated supplements sometimes contain hormone precursors or hidden ingredients that perturb endocrine balance and liver function. Clinical reports warn of adverse effects in older men. Actionable advice: bring all supplements and medications to your clinician for review. Shared decision-making reduces risk of hormonal imbalance and interactions. Obesity and metabolic syndrome amplify inflammation and hormonal shifts tied to prostate symptoms. Weight loss and metabolic control often correlate with symptom improvement in observational and practical application. Aim for moderate aerobic activity most days, resistance exercise twice weekly, and prioritize vegetables, legumes, and healthy fats to support metabolic and prostate health. Prostate symptoms, erectile function, and testosterone interact. Addressing lifestyle reduces symptom burden and may improve sexual function measures without implying cure. If urinary symptoms are becoming more frequent, it often signals changes in how the prostate responds as you age. Many seniors don't realize these symptoms can come from reversible factors that a quick evaluation can uncover. Brief clinical check helps identify what can be adjusted early, reducing the stress and uncertainty many men feel. Early guidance also leads to safer, more personalized steps that fit your health history and daily routine. Bridge explanation: chronic low-grade inflammation and microvascular dysfunction often mediate lifestyle impacts on prostate tissue integrity and symptom expression in older men. Testing for reversible contributors like glucose control, lipid profile, and inflammation markers helps prioritize interventions that reduce prostate-related symptoms and overall cardiometabolic risk. Final practical item: prioritize interrupting sitting with standing or brief walks, especially after meals. These small repeated actions yield measurable improvements in circulation and metabolic mark. Sample micro plan: set a 30-minute timer, stand for 2 to 5 minutes, do 3 simple stretches, and walk 5 minutes each hour to accumulate meaningful movement. Nutrition supports prostate health. Emphasize plants, fiber, and healthy fats while minimizing ultra-processed foods that promote inflammation and metabolic dysfunction in older adults. Sleep and stress matter. Poor sleep worsens inflammation and hormonal balance, while simple relaxation practices support restorative physiology relevant to prostate and sexual health. Avoid tobacco and limit alcohol. Both are associated with worse prostate symptom scores and systemic inflammation, increasing overall health risks in senior men. Reassurance: many contributors are modifiable. A focused plan with movement breaks, nutrition changes, and medical review often reduces symptoms and improves well-being without invasive steps. Resources: ask your clinician for targeted testing, bring a full medication and supplement list, and request practical movement prescriptions tailored to your medical history. Clinical insight: prostate symptoms often overlap with cardiometabolic health. Integrating cardiovascular risk reduction with prostate focused lifestyle changes benefits overall function and longevity. Quick checklist: set a 30-minute sitting limit, add daily walks, prioritize plant forward meals, optimize sleep, and consult your clinician about supplements and symptoms. This message feels relevant to you. Consider taking a moment to reflect on your own experience. Sharing your story helps other seniors understand they're not facing these changes alone. Noting even one small change you plan to try this week can create meaningful momentum. Forward progress comes from simple, practical actions repeated over time, not from perfection. If you found this helpful, consider subscribing so you continue receiving clear, evidence-based guidance for men's health. New updates are shared regularly to support men over 60 with practical, science-informed lifestyle strategies. Also watch the next video, which explains natural ways to support testosterone levels and healthy circulation. Together, these videos help you build steady progress toward healthier aging and better daily performance. Recap: reduce prolonged sitting, increase frequent short movement breaks, manage weight and supplements with your clinician, and prioritize sleep and stress reduction for prostate-friendly aging. Thank you for watching. Small, consistent lifestyle changes can meaningfully support prostate health and overall well-being. Talk with your healthcare team to create a plan tailored for you.